about 20% of the population, or 1 in 5 individuals, will have problems in learning to read. Early intervention is critical. If a child is diagnosed earlier, these kids tend to respond to intervention faster and make the most gain. Hi, I'm Dr. Laurie Gauger, and I am a clinical assistant professor in the Department of Speech, Language, and Hearing Sciences at UF. I'm also the director of the UF Reading Disabilities program. There are several types of learning disabilities. The two that involve reading would be dyslexia, and there's also a language-based learning disability. Both of those types of learning disabilities, children demonstrate problems in learning to read and write and spell. The skills that support a child's ability to learn to read actually begin to develop at birth, right? When oral language starts to develop, because oral language is the foundation for reading and writing. Parents just making sure they're developing and doing everything they can to enrich their child's environment by talking to them constantly, even infants, reading books with infants, looking at pictures with infants, just talking to them on their daily basis is really going to help develop their oral language skills, which makes these kids more ready to learn how to read when they start preschool. Reading to your children, having lots of books in your home, having your child see you reading is very important. Again, the overall thing is just supporting their language development. Think about this. A 5-year-old who has trouble learning the alphabet becomes a 6-year-old who has trouble learning the sounds that go with letters to read simple words. That child becomes a 7-year-old whose sight word vocabulary is very limited, right? And that is going to end up affecting their reading fluency and their reading comprehension. And this is a major problem because starting in 4th grade, children are no longer learning to read in the classroom, they're reading to learn. We know what works in intervention. So the earlier that we can get in there and help them, the better they stay closer to grade level. And then finally, the academic and social and emotional repercussions that result from a kid struggling and learning to read can be enormous, right? So we can also limit those by addressing their needs earlier and then prevent these secondary, blows to their self-esteem.